Welcome to Delta Dental of Arkansas. We are proud to serve you. Our goal is to give you access to quality dental care. Delta Dental Smiles benefits will help you to keep your teeth healthy. Delta Dental of Arkansas's role is to provide access to care through a primary care dentist, help you understand your benefits. We are here to help if you need us. Our toll-free number is 1-866-864-2499. To contact Relay Arkansas, call 711. For hearing impaired services, please use the Relay Arkansas number. You will need to tell them our toll-free number. Our days and hours excluding holidays are Monday to Friday, 7 a.m. to 7 p.m. Our website is deltadentalsmiles.com. To reach us by mail, Delta Dental of Arkansas, P.O. Box 6427, Sherwood, Arkansas 721724. Eligibility. Eligibility is determined by the Arkansas Department of Human Services, DHS. For more information, see the DHS Medicaid Handbook. If you need us, please contact us if you have any questions about Delta Dental Smiles, such as finding a dentist or help making a dentist appointment. Our toll-free number is 1-866-864-2499. Using this handbook. This handbook explains the following: Delta Dental Smiles benefits, how to use benefits, rights and responsibilities. This handbook also helps to answer some questions people often ask. This handbook cannot tell you everything. Laws and rules change, so some things might have changed since this book was printed. This handbook is not a legal document. It is just a guide, not a contract. Call us at 866-864-2499 if you have questions. There are some terms used in this handbook you should understand. You, or beneficiary is a person enrolled in Delta Dental Smiles. We, us, our is Delta Dental of Arkansas. Primary care dentist, the dentist you pick to provide services to you. See page 7 for more information. Delta Dental Smiles Network dentist is a dentist who has signed an agreement with us to provide services to you. Medically necessary. A product or service is medically necessary if a practical dentist would provide the service to prevent, diagnose, or treat your illness, injury, or condition. The service must be provided by generally accepted standards of dental practice. When there are changes. Sometimes we need to make changes to this handbook. If so, we will let you know in writing 30 days before the changes happen. Dental care. When should you see a dentist? You should see your primary care dentist, PCD, to get your teeth cleaned at least once a year. Be sure to schedule the next dental visit before leaving the office. It is important to brush teeth twice a day, after breakfast and before bed. Use toothpaste that has fluoride. Don't share toothbrushes. Store them in the open air with the bristles up so they dry out between uses. You do not need to rinse your mouth after brushing. The toothpaste left in your mouth helps stop cavities. Floss once a day before bed. Flossing gets out food between the teeth your toothbrushing didn't get out. If you are pregnant. Pregnant women need to see the dentist as part of good prenatal care. Infection in your mouth, especially gum disease, can affect your baby. There are links between gum disease in pregnant mothers and preterm birth. There are many risks of preterm birth for the baby. These include low birth weight, problems with learning, and a higher risk of cerebral palsy. Some studies indicate more than 15% of preterm births may be caused by gum disease. Keeping babies healthy is why we support extra teeth cleanings for pregnant women. Tell your dentist if you are pregnant. Your Delta Dental Smiles plan offers an extra cleaning for free. If you have heart disease. Teeth cleanings can lower the risk of heart attack and stroke. Studies show infection in the mouth may be linked to heart issues. Cleaning the teeth gets rid of the bacteria in the mouth that can lead to infection. This prevents mouth infections from spreading to other parts of the body. Be sure to tell your dentist if you have heart disease. If you have diabetes. People with diabetes are more likely to get gum disease. There are many ways diabetes can affect the mouth. A diabetic person may have less saliva, spit, which causes a dry mouth. Saliva protects teeth, so people with a dry mouth often get more cavities. Gums can become swollen and bleed, which can cause mouth infections. Gum disease and infections can cause blood sugar to rise. This makes it harder to control blood sugar. Regular dental visits can help control blood sugar. This can also slow down the worsening of diabetes. Be sure to let your dentist know if you have diabetes. If you have periodontal disease. People with periodontitis, gum disease, need special dental care. Skipping dental care allows plaque, a sticky substance composed of germs on teeth, to build up and get below the gum line where a toothbrush can't reach. Gums become swollen and may bleed and lead to other problems both in your mouth and body. Be sure to talk to your dentist about periodontitis, gum disease, regularly once you know you have it. Your Delta Dental Smiles plan offers an extra cleaning for those diagnosed and treated for gum disease. Primary Care Dentist, PCD. What is a primary care dentist? A primary care dentist, PCD, is a dentist who will be your regular dentist. It is important to have a dentist you regularly see. Your PCD will help you stay healthy and keep track of your dental needs. If you have special needs outside of regular dental care, your PCD can help arrange for care. Choosing a PCD. Once you are signed up with Delta Dental, you have 30 days to select your PCD. If you do not choose one, Delta Dental will choose one for you. To find a Delta Dental Smiles dentist, visit www.deltadentalsmiles.com. The search will help you find a dentist near you. It can also tell you things about each dentist, such as their office hours or languages spoken in the office. Call us for help finding a dentist or with questions, toll-free, at 1-866-864-2499. Using a dentist who is not your PCD. We hope you will always try to use your PCD when getting dental treatment, but it is not required to only have dental treatment from your PCD. You can have dental treatment from any Delta Dental Smiles dentist. Changing your PCD. You can change your PCD anytime. Call us at 1-866-864-2499 to let us know you want to change your PCD. We can help you find a new PCD. Choosing a dentist not in the network. If you choose to see a dentist that is not part of the Delta Dental Smiles network, you may have to pay for any services provided by this dentist. If you think you may need to see a dentist that is not part of the Delta Dental Smiles network, contact us first. We may be able to help you decide if a network dentist can provide the services. What if my PCD leaves the network? If the dentist you are seeing leaves the Delta Dental Smiles network, we will let you know. We will also send you information on how to select a new dentist. Scheduling an appointment. After you pick a PCD, call your PCD to make an appointment. Make sure the dentist is part of the network. Make sure they know you have Delta Dental Smiles. Call us for help making an appointment. Be sure to take your Delta Smiles ID card to the appointment. What if I need to cancel my dental visit? If you cannot keep the appointment, be sure to call the dental office to cancel the appointment. When possible, please try to cancel the appointment at least 48 hours prior to the appointment. This helps the dentist find someone else for your appointment time. Try to reschedule your visit for another day. What if I miss an appointment? A missed dental appointment presents a problem for both you and the dentist. It causes a delay in improving your dental health. The dentist holds appointment times just for you. Please value your dental appointments. Many offices have missed appointment policies. Ask about your PCD's policy. Your PCD may decide to not see you if you miss appointments without calling. ID cards. We mail each new beneficiary a temporary Delta Dental Smiles ID card. Once there is a primary care dentist, you will receive a new ID card. Your ID card has a lot of information. It contains basic information about your Delta Dental Smiles plan, your ID number, and your PCD. It shows where you can send claims to: P.O. Box 6247, Sherwood, Arkansas 72124, your payer ID number 71056-1140-DDAR, customer service 866 864-2499. The State of Arkansas, 800-482-8988. Our website, www.deltadentalsmiles.com. This card is not a guarantee of payment. The ID card is for dental services only. This card has important information about your dental benefits. Please present this card to your dentist every time you visit their office. Only you can use your ID card for dental services. If someone else uses the ID card to get services, that person will have to pay for the services. Letting someone use your ID card is fraud and can be punishable by law. How to replace a lost ID card. If you lose the ID card and need to get a new card, you can call us toll-free at 1-866-864-2499 as soon as you know your card is missing. Print one on the customer toolkit at www.deltadentalsmiles.com. Non-emergency transportation. Need a ride to your dentist visit? You can call between 8 a.m. and 5 p.m. Monday through Friday, except on holidays, to schedule a ride to your dentist and back home. Each region of the state has a different transportation broker. To schedule a ride at no cost, you must call at least 48 hours before your appointment. Weekends and holidays do not count. For example, for Monday, call by Thursday. For Tuesday, call by Friday. For Wednesday, call by Monday. For Thursday, call by Tuesday. For Friday, call by Wednesday.
If you are in Region A, call Verida at 1-888-833-4136. If you are in Region B, call Verida at 1-888-833-4128. If you are in Region C, call Verida at 1-888-833-4130. If you are in Region D, call Verida at 1-888-822-6155. If you are in Region E, call Central Arkansas Development Council at 1-800-385-9992. If you are in Region F, call Area Agency of Aging of Southeast Arkansas at 1-844-683-2300. If you are in Region G, call Verida at 1-888-833-4135.
Always call your transportation broker first. If there is a problem, then call the Medicaid Non-Emergency Transportation Helpline at 1-888-987-1200. This handbook is just a summary of net benefits and services. Read your Arkansas Medicaid Beneficiary Handbook from the Department of Human Services for more information about transportation benefits and services. Billing information. How much do I pay? Delta Dental pays for covered services. You pay nothing for your covered dental services as long as you see a Delta Dental Smiles Network dentist. There may be times when you agree to services that are not covered by Delta Dental Smiles. You will have to pay for those services. Make sure you ask your dentist what services you may have to pay for. Delta Dental may pay the dentist less than the amount charged for a covered service. In that case, your dentist cannot ask you to pay the rest of the bill. If you do not use a dentist or clinic that is part of the Delta Dental Smiles Network, you may have to pay the bill. If you do not have Delta Dental Smiles when services are provided, you will be responsible for paying those services. How to file a claim. A dentist who is part of the Delta Dental Smiles Network should file your claim for you. However, if you need to file a claim, call us toll-free at 1-866-864-2499. What if I get a bill? Your Delta Dental Smiles dentist should only bill you for non-covered services that you agreed to pay for while in the office. If you receive a bill and don't know why, call us for help, toll-free, at 1-866-864-2499. Is there a maximum amount Delta Dental will pay each year? Yes. You have a $500 annual maximum benefit. If you have other dental insurance. If you have other dental insurance, that insurance will pay before we pay. We will not pay co-payments for other insurance. Your dentist must bill your other insurance before billing us. Tell your dentist that you have other insurance. We will not pay anything after your other insurance pays. Other times, we may not pay for services. If you are hurt in an accident, we may not pay until other insurance pays or denies payment. If you get money from a lawsuit because of the accident, use that money to pay for your dental bills. If there are still bills to be paid, after the money you get is gone, contact us to see if we will pay these bills. If you are hurt on the job, we will not pay until workers' compensation is paid or denied payment. Dental emergency. What is an emergency dental condition? Examples of emergency dental conditions are severe pain, infection, an injury where your health could be in danger, severe bleeding, uncommon swelling. What to do in a dental emergency? In case of an emergency, do one of the following. Call 911 if you think your life is in danger. You do not need approval from us to receive emergency dental services. You have the right to use any dentist in an emergency. During normal business hours, call your primary care dentist first. If they are unable to help, call Delta Dental at 1-866-864-2499. We will help find a dentist near you and get an appointment set up. You should get an appointment within 24 hours. After regular office hours, call your dentist's after-hours line if available. If the dentist office does not have an after-hours line, call Delta Dental at 1-866-864-2499 to speak to a healthcare professional. Go to the emergency room closest to you. What if I'm out of Arkansas and have a dental emergency? If your life is in danger, call 911. If you need emergency dental services while traveling, call us toll-free at 1-866-864-2499 between 7 a.m. and 7 p.m. We will help you find a dentist in the area you are visiting. After 7 p.m., a healthcare professional will be available to speak with you regarding the dental emergency. Call us toll-free at 1-866-864-2499. Covered services. For a product or service to be paid by us, it must be a medically necessary dental service, done by a Delta Dental Smiles Network dentist, covered under the Arkansas Medicaid dental program, including any limits. We understand that dental language can be complicated. Feel free to talk to your dentist about any benefits you do not understand, or call us toll-free at 1-866-864-2499 for help. Covered services for adults. Regular dental care helps to keep your teeth healthy. Covered dental services are available at no cost as long as you see a Delta Dental Smiles dentist or have made plans to in advance with us to see an out-of-network provider and have not used your $500 annual maximum. If you agree with your dentist for services that are not covered by Delta Dental Smiles or over your $500 annual limit, you will have to pay for those services. Covered dental services are oral exams, including regular exam, no more than 1 per calendar year, and limited exam, problem-focused, no more than 12 per calendar year. Preventative services, including teeth cleaning, no more than 1 per calendar year, 1 additional cleaning during pregnancy or 3 months after delivery of the baby, and fluoride, put on teeth, no more than 1 per calendar year. X-rays, including bite wings, no more than 1 in a calendar year, and full mouth X-ray, no more than 1 every 5 years. Restorations, including silver fillings, no more than 1 every 2 years per tooth surface. Tooth-colored filling on front teeth, no more than 1 every 2 years per tooth surface. And stainless steel crown, permanent, no more than 1 every 5 years per adult tooth. Surgery, including removing teeth, does not apply to $500 yearly benefit. Biopsies, treating abscesses, removal of bony protrusion on roof of mouth, no more than 1 per lifetime. Removal of bony growth in the jaw along surface near tongue, no more than 1 per lifetime. Other services, dentures, partials. Lab fee does not apply to $500 yearly benefit. Gum maintenance, 1 per calendar year with prior history of gum therapy, such as root planing and scaling. One additional cleaning per calendar year with prior history of gum therapy, such as root planing and scaling. Emergency services. Emergency dental services are used to stop severe pain or get rid of infections, including problem-focused exams, tooth removal and/or oral surgery, biopsy, surgical incision and drainage, treatment to improve quality of life, x-rays of the entire tooth or mouth, office visit after regularly scheduled hours. Basic function services. The following services help you keep basic functions, such as talking or eating. Talk to your dentist to make sure these services are covered before you have any work being done, including fixing large cavities, scaling and root planing, no more than 1 time per quadrant every 24 months, stainless steel crowns, removing teeth and/or reshaping jawbone, dentures, no more than 3 per lifetime, denture repairs and relines, no more than 1 every 3 years, complete dentures, no more than 1 per lifetime. Lifetime benefits. Some benefits are only covered 1 time in your life, for example, dentures. If Medicaid has already paid for you to have one of these services, you may not be able to have the service under our plan. Call us with your questions about these services. Prior authorizations. Approval. Certain services or benefits require Delta Dental's pre-approval. Your dentist is responsible for getting approval from us. If the services are not approved by Delta Dental, you and your dentist will receive written notices. You do not have to pay for services you did not need and did not choose to receive. If you choose to have a service you do not need, you will have to pay for it. You may appeal Delta Dental's decision to not pay for a service by following the grievance and appeals process, beginning on page 22 of this handbook. Services not covered. The list below shows some of the services that are not covered by Delta Dental Smiles, unless medically necessary. You can agree with your dentist in writing to have these services done. If these services are done, you have to pay the dentist. Please note, this is not a complete list. Other services may not be covered. If you have questions about whether a service is covered, call us at 1-866-864-2499. Services that are not covered. Cosmetic procedures, gold foils and inlays, braces, provisional services, space maintainers, splinting, teeth whitening, experimental services. Beneficiary rights and responsibilities. Getting dental services is a private matter. We respect your right to privacy. You have the rights and duties listed below. Beneficiary rights. Beneficiaries have rights if you get services through Delta Dental Smiles. These rights are: 1. You have the right to be treated with respect, dignity, and privacy. 2. You have the right to receive care. Race, color, nationality, disability, sex, religion, or age do not matter. 3. You have the right to get correct, easy-to-understand information to help you make good choices. 4. You have a right to file a complaint or grievance about us, a dentist, or the care you receive. 5. You have the right to file an appeal about an action or decision we made. 6. You have a right to know: A. How Delta Dental decides whether a service is covered and/or medically necessary. B. Who in Delta Dental's office decides these things. 7. You have the right to know the names of the dentists in the Delta Dental Smiles network. 8. You have the right to pick from a list of enough dentists that you can get the right kind of care when needed. 9. You have the right to take part in all decisions about your dental care. This may include refusing treatment. 10. You have the right to get a second opinion from another dentist about what kind of treatment is needed. 11. You have the right to be treated fairly by us, Delta Dental Smiles Network dentists, and other dentists. 12. You have the right to: A. Talk to a dentist in private. B. Have dental records kept private. C. Request a copy of dental records. D. Ask for changes to those records. 13. You have a right to know dentists who can advise you about: A. Health status. B. Dental care. C. Treatment. 14. You have a right to know you are not responsible for paying for covered services. Delta Dental Smiles Network dentists cannot require you to pay for your covered services. 15. You have the right to receive all information, including, but not limited to, informational materials, instructional materials, available treatment options, and alternatives in a manner and format that may be easily understood. Please contact us toll-free at 1-866-864-2499. 16. You have a right to get a spoken translation at no cost for all non-English languages, not just those identified as prevalent. 17. You have the right to recommend changes in policies and services under Delta Dental Smiles. Write us or call toll-free at 1-866-864-2499. 18. You have the right to receive detailed information on emergency and after-hours coverage to include, but not limited to, A. What constitutes an emergency medical condition, emergency services, and post-stabilization services. B. Emergency services do not require prior approval. C. The process and procedures for obtaining emergency services. D. The locations of any emergency settings and other locations at which providers and hospitals provide emergency services and post-stabilization services covered under the contract. E. Your right to use any hospital or other setting for emergency care and post-stabilization care services. 19. You have the right to be able to request and receive a copy of your medical records and to request that they be amended or corrected. You get one free of charge. 20. You have a right to have your privacy protected in accordance with the privacy requirements in federal law to the extent that they are applicable. 21. You have the right to exercise these rights without adversely affecting the way Delta Dental, providers, and DHS treats you. 22. You have the right to be free from any form of restraint or seclusion used as a means of coercion, discipline, convenience, or retaliation as specified in the federal regulations on the use of restraints and seclusion. 23. You have the right to make recommendations about these rights and responsibilities. Beneficiary responsibilities. There are things you need to do as a Delta Dental Smiles beneficiary. Doing these things helps you get the most out of your dental benefits. It also helps us work with you better. These responsibilities are: 1. You should try to follow healthy habits. 2. You should work together with your dentist to pick a treatment that you have agreed on. 3. If you have a disagreement with Delta Dental, you should try first to resolve it using Delta Dental's grievance process, beginning on page 22 of this handbook. 4. You should learn what Delta Dental Smiles does and does not cover. 5. You should read this handbook to understand how the rules work. 6. If you make an appointment, you should try to get to the dentist's office on time. If you cannot keep the appointment, be sure to call and cancel it. 7. You should be active in decisions about your health care. 8. You should present your Delta Dental Smiles ID card when receiving dental care. 9. You should report any fraud or wrongdoing to Delta Dental or the proper authorities. This may be about Delta Dental or other dental or medical plans. See page 27 of this handbook on how to report waste, abuse, or fraud. 10. You should understand your health problems and participate in developing mutually agreed-upon treatment goals. 11. You should inform Delta Dental of any change of address or any changes to enrollment that could affect your eligibility. Use your benefits wisely. 1. Do not get services you do not need. 2. Follow your dentist's advice. This will help with your dental and overall health. 3. Do not try to get prescription drugs you do not need. This is tracked, and Medicaid can restrict you to one drugstore. Grievance and appeal. How to file a grievance or ask for an appeal. You can tell us if you are not happy with any part of Delta Dental Smiles, Delta Dental of Arkansas, a dentist, the services you received. You will get an answer if you file an appeal or grievance. What is a grievance? A grievance is a complaint about Delta Dental Smiles, Delta Dental of Arkansas, a dentist, services you received. How do I file a grievance? You can file a grievance by doing one of the following. Call toll-free at 1-866-864-2499. Send a fax to 833-866-4650. Write us at Delta Dental Smiles, Attention Appeals and Grievances, P.O. Box 6247, Sherwood, Arkansas 72124. We can help you complete any forms and answer your questions about filing a grievance. Processes and timeframes. We will let you know we received your grievance. We will return a summary of the process and timetable for resolving the grievance. We will respond to a grievance within these times. Standard non-clinical grievance within 30 calendar days of receiving your grievance. Non-emergency grievance that involves active clinical issues within 5 business days of receiving your grievance. Grievance related to ongoing issues involving emergency care within 24 hours of receiving your grievance or by the close of the next business day. We may extend the time frame by up to 14 days if you or someone speaking for you requests the extension. We think there is a need for more information or a delay may be in your best interest. If we extend the time frame, we will give you notice of the delay, provide notice that you may file a grievance about the decision to delay, resolve the grievance as fast as possible and no later than the date the extension expires. Delta Dental will respond to a grievance in writing within the time frames described above. A state fair hearing is not available for a grievance. What is an appeal? An appeal is a request for a review of an action by Delta Dental. An appeal can be for any of the following: denial of services or where we only approved part of a service, limiting or stopping services that had been approved, denial of all and or part of a payment for a service, not providing services fast enough, not acting within time limits for appeals and grievances. Processes and timeframes. Filing. You can appeal by calling or writing to us within 60 calendar days after you receive the denial, reduction, or failure to pay notice. You must follow up a call with a written appeal. File an appeal by calling toll-free at 1-866-864-2499, sending a fax to 833-866-4650. Writing us at Delta Dental Smiles, Attention Appeals and Grievances, P.O. Box 6247, Sherwood, Arkansas 72124. We can help you complete any forms and answer your questions about filing an appeal. We will let you know we got your appeal and give you a summary of the process and timetable for resolving the appeal. This will include information on the following: when you can present evidence or testimony and to make legal and factual arguments, your right to request records from the file relating to your appeal. This may include dental records and other evidence used by Delta Dental or its representatives. The timetable we will follow until we send the final decision. Timing. We will resolve an appeal within these times. Standard non-clinical appeals within 30 calendar days of receiving your appeal. Non-emergency appeals that involve active clinical issues within 5 business days of receiving your appeal. Appeals related to ongoing issues involving emergency care within 24 hours of receiving your appeal or by the close of the next business day. Extensions. We may extend these time frames by up to 14 calendar days if you or someone speaking for you request an extension, or we think there is a need for more information or a delay may be in your best interest. If we extend the time frame, we will give you notice of the delay, provide notice that you may file a grievance about the decision to delay, resolve the appeal as fast as required by your health condition, and no later than the date the extension expires. If Delta Dental does not follow the times above, you can move to the state fair hearing process. Opportunity to request hearing on appeal. If you want to provide written or spoken testimony, we will give you an opportunity before a decision on the appeal is made. You may be represented by an attorney or other representative. Resolution of appeal. A decision on an appeal will be in writing. We will use our best efforts to call you to inform you of the results of an expedited appeal. State fair hearing. If you are not happy with our decision on your appeal, the second step in the appeal process is to ask for a state fair hearing. You must ask for this within 120 calendar days of receiving the appeal decision. To request a hearing, write to Arkansas Department of Human Services. Attention, Arkansas Medicaid Appeals Liaison, 700 Main Street, Little Rock, Arkansas, 72201. You can speak for yourself or have someone else speak for you. This could be a friend, a relative, a spokesperson, a lawyer. Your dentist may ask for a state fair hearing for you. You need to give your dentist approval in writing first. You need to sign a form. We will give you a form to sign if you ask us. This form will say that you know your health information may be shared publicly during the state fair hearing process. Continuing your benefits. You can ask for your benefits to continue during the appeal and fair hearing processes. All of the following must apply. Your appeal has to do with a change in our approval of care already in place. Your initial appeal was filed within the time limit stated above. The services were ordered by an approved dentist. The approved time of service has not expired. You made a request on or before the later of the following dates: 10 calendar days from the date of our notice to you limiting your benefits, or the intended effective date of the action stated in the notice. We will pay for the services you ask to be continued if the state fair hearing decision is in your favor. If it is not in your favor, you may have to pay for all or part of the services used. Fraud, waste, abuse, and overpayments. We are dedicated to doing business in an ethical and legal manner. We want you to prevent and report fraud, waste, and abuse. If you suspect fraud, you need to report it. Let us know if you know someone that is doing something wrong. You can report it to Delta Dental of Arkansas at 1-866-864-2499 or directly to the state or federal agencies on page 28. Definitions. Abuse refers to overused or unneeded services. Abuse also includes member actions that result in unneeded cost to Delta Dental Smiles. Fraud is a false action used to get something of value. Waste is the misuse of services. Overpayments refer to any amount that is not approved to be paid by Delta Dental Smiles. This may be the result of wrong or improper cost reporting, improper claims, unacceptable practices, fraud, abuse, waste, a mistake. Examples of fraud, waste, abuse, and overpayments. Giving your ID card to someone else to use. Billing for healthcare services that are not needed. Billing twice for the same service. Using the wrong billing code to get extra payments. Making false documents by changing the date of service for a claim. Medical records. Paying or taking a bribe. Billing for services done by others. Giving false or misleading information about services. Misrepresenting the services that are done, such as changing a code to get extra payments. Keeping overpayments or not reporting overpayments. Dentists can be sanctioned for unpaid overpayments. Giving or ordering services and tests that are not needed. Submitting claims for services ordered by a dentist excluded from federal and or state-funded healthcare programs. Lying about degrees and licenses. Report of fraud, waste, abuse, and overpayments. Report to Delta Dental. You can report directly to Delta Dental of Arkansas. Call us toll-free at 1-866-864-2499. Report to state agencies. You can report to the agencies listed below. Call the Arkansas Department of Human Services at 1-800-482-8988. Report to the federal government. Contact the U.S. Department of Health and Human Services, Office of the Inspector General. Contact this office by phone, fax, email, or mail. U.S. Department of Health and Human Services, Office of Inspector General. Attention OIG Hotline Operations. P.O. Box 23489, Washington, D.C. 20026. Phone 1-800-HHS-TIPS. That's 1-800-447-8477. Fax 1-800-223-8164. TTY 1-800-377-4950. Email hhstips@oif.hhs.gov. Your privacy. Your privacy is important to us. We respect and protect your privacy. Delta Dental uses and shares information to provide you with dental benefits. We want to let you know how your information is used or shared. your protected health information, PHI. PHI means protected health information. PHI includes your name, beneficiary ID number, or other identifiers and is used or shared by Delta Dental. Why does Delta Dental use or share your PHI? To provide for your dental treatment, to provide for your dental care, to review the quality of the care you get, to tell you about your choices for care, to operate Delta Dental Smiles, to use your PHI for other purposes as required or permitted by law. When does Delta Dental need your written authorization, approval to use or share your PHI? We need your written approval to use or share your PHI for purposes not listed above. What privacy rights do you have? To look at your PHI, to get a copy of your PHI, to amend your PHI, to ask us not to use or share your PHI in certain ways, to get a list of certain people or places to whom we have given your PHI. How does Delta Dental protect your PHI? We use many ways to protect PHI across our company. This includes PHI in written word, spoken word, or in a computer. Below are some ways. Policies and rules to protect PHI. Limit who may see PHI. Only our staff with a need to know PHI may use it. Our staff is trained on how to protect and secure PHI. Staff must agree in writing to follow the rules and policies that protect and secure PHI. We secure PHI in our computers. PHI in our computers is kept private by using firewalls and passwords. What must Delta Dental do by law? Keep your PHI private. Give you written information such as this on our duties and privacy practices about your PHI. Follow the terms of our Notice of Privacy Practices. What can you do if you feel your privacy rights have not been protected? Call or write us to report your suspicions. Call or write to DHS to report your suspicions. We will not hold anything against you. Your action would not change how we treat you in any way. The above is only a summary. Our Notice of Privacy Practices has more information about how we use and share PHI. Our Notice of Privacy Practices is on our website at www.deltadentalsmiles.com. You may also get a copy of our Notice of Privacy Practices by calling us at 1-866-864-2499. Here's some helpful information for Delta Dental Smiles. Delta Dental of Arkansas. Customer service 1-866-864-2499. Website deltadentalsmiles.com. Mailing address P.O. Box 6247, Sherwood, Arkansas 72124. Arkansas Department of Human Services. Customer service line 1-800-482-8988. Complaint hotline 1-888-987-1200. Complaint hotline TDD 1-800-285-1131. Fraud hotline 1-855-527-6644. Website humanservices.arkansas.gov. Arkansas Relay Service 711. If there is a problem with non-emergency transportation, call the Medicaid Non-Emergency Transportation Helpline at 1-888-987-1200 for free.